Hello friends, in this video we will talk about swallowing problem. We also say it as dysphagia. So there are several reasons for swallowing issues. It can be anatomic, it can be genetic, sometimes it's neurological, and it can be some other reason also. Like if you talk about the anatomic problem, then it can be as you can see here, like cleft lip and palate. You can see swallowing problem in tongue malformation, micro or retrognathia, or it can be some kind of coronal atresia. When we talk about genetic, then it can be like you can see in some syndrome like Mobius syndrome, Apert, Prader-Willi syndrome, and there are lots of syndrome where you can see swallowing issues. When we talk about neurological problem, then it can be some if there is any malformation at the level of brain and spinal cord, or we can also see swallowing problems in the patients with strokes or aphasia. Swallowing problem also can be seen in the patients with dysarthria, or if the patient have some demyelinating diseases like multiple sclerosis, or the patient have some degenerative brain disease and all. And there can be some other reasons also. So, as we have seen that there are several reasons for swallowing issues. So let's talk about like how we can identify that the patient have swallowing problem or not. In that case, like suppose there is a more than one episode of gagging, coughing, or choking. In that case, or the patient have like gagging, coughing, or choking during or after drinking, and patient may have difficulty in managing saliva, or like gurgly voice, or you can see a watery eye during or after eating. And then like in the cases of like frequent upper respiratory infection, and the patient may have problem like frequent vomiting or regurgitation, and like eating very rapidly or eat or drink large amount at a time, and like extra effort or difficulty in chewing or swallowing. They have problem in storing food or drink in mouth, or they may have problem in like loss of food or drink during or after the meal. So if you find any of the reason, any of the problem in in some patient, then that can be a case of swallowing problem, or you can say dysphagia. So like if when we talk about like the different stages of dysphagia, or sorry, different stages of uh, swallowing, then the first stage is your oral phase, and the second one is your pharyngeal phase, and the third one is your esophageal phase. So definitely the oral phase takes almost like 8 to 10 seconds, and when we talk about the pharyngeal phase, it takes one maximum like 1 to 2 seconds. So that like, the pharyngeal phase is one of the fastest phase. And then when we talk about the esophageal phase, then again it takes some time, like almost of you can say 20 seconds to 1 minute. So basically there are three stages of swallowing: the oral, pharyngeal, and esophageal phase. So now the question is like, suppose if someone have swallowing problem or dysphagia, then in that case, whom should we contact? Where to approach? So that's the like one of the most important question in front of the patient. So that's the reason, and that's the aim of making this video. Like one should be aware about like where should go, where uh, whom to approach. So that's one of the important questions. So for that reason, you should approach a speech language pathologist. If you have some swallowing problem, dysphagia, that can be because of like it can be because of some kind of neurological disorder, or it can be some problem at the level of like oromotor structures, or it can be like many patients may have swallowing problems after head and neck cancer surgery. So after that, you can must visit a speech language pathologist. Uh, but before visiting a speech language pathologist, you should be confident that the speech language pathologist is well qualified to treat dysphagia, because not every speech language pathologist deals with the problem of like deals with dysphagia patients. So he should be well qualified, and he should have interest in people, in helping patients with dysphagia. So that's very important. So okay, bye bye, see you in the next video.